it's one thing to bring the data to the user, but it's another thing to make it usable and intuitive and secure. The next step is for us within industry as well as private developers to kind of pick up the ball and run with it even farther, to make that data usable, interactive, and just simple. Hi, this is Mike Jackson with Adobe Systems, and I'm here in Sunnyvale, California, Silicon Valley, with Dr. David Lansky, who's the Chief Executive Officer of the Pacific Business Group on Health. We just completed a very exciting Board of Directors meeting where I was co-keynote speaker with Todd Park, the Chief Technology Officer of the Health and Human Services Administration.
So we're getting increasingly excited about this, and we're committed to fueling this emerging health data ecosystem with ever more data. And we're actually broadening the scope of the data release to really everything we possibly can.
So, Dr. Lansky, first of all, I'd like to thank you for inviting us to take part in your Board of Directors meeting. It was very rewarding as far as I was concerned.
Thank you, Mike. Thanks for coming. We really appreciated your insights today.
Oh, thank you. If you could, for our viewers, please explain what is the Pacific Business Group on Health?
Yeah, PBGH is an association of about 50 large employers, all of whom have a big California workforce. Some real household names like Intel, Cisco, Safeway, Chevron, and they all have in common a concern about the quality and cost of healthcare in California and nationally. So our job is to help them work with programs in the marketplace and in the policy community to really improve the affordability and quality of healthcare.
That's great. And so from your perspective, I know we talked a lot today about the Blue Button Initiative, the project that was launched within CMS and the VA specifically.
Right.
What are some of your perspectives on how the lessons learned there could be implemented within private industry or within your payer groups particularly?
Well, one of the key things our employers recognize is that their employees have to be much more engaged in their own healthcare, in their own healthcare decisions, in choosing a health plan, choosing a doctor, choosing a treatment, managing their own daily health. And right now, they often don't have the information or the tools to do that. So our members have for years been looking for a way to help people get their own information and get really good tools to use to manage their own health. So this initiative is one of the first times we've seen a chance to have most regular folks get their health information and then begin to look to the private market of innovators and developers to create really high-value applications using your own health data. So it's a really powerful opportunity for consumer engagement.
Wow, that's great. I can tell you from Adobe's perspective, we realized that the VA was an ideal place. It was a double-sided coin, I must say, though. The positive at the VA is that they are well ahead of adoption and leveraging of technology. So the onset of electronic medical records, for example, their VISTA system was well ahead of the curve. One of the challenges that's presented when you try to replicate that, though, is that within the VA it's a closed system. Yeah. So all of the veterans have their data centrally located in one place, and we find that they're centrally located in one place. So it's easy to grab all that data and make it available to the patient. On the public side, however, the patient may change employers, he may change insurance plans, he may change geographic locations. So what are some of the challenges that you foresee in transferring the lessons learned to the public sector, or I'm sorry, the private sector, and your group specifically?
Well, one of the strengths of this approach is that it puts each of us individually in charge of our own information. So whatever doctor I go to, wherever I change jobs, move communities, change insurance companies, I can still get all my data and put it together in one place on one of the new platforms that are emerging, and then find applications like the kind you've been developing to take advantage of that data. So I become master of my own fate in terms of my health information, instead of relying on all these other organizations to manage it for me. So this is a great opportunity to enable the patient to be the manager over time and space of their own information.
Well, I can tell you from Adobe's perspective, it's refreshing to hear you say that, because as we've talked to payer groups as well as providers and even patients themselves, and we talk about the transient nature these days of the patient, if you will, the one common denominator that stays consistent through all those changes is the patient himself. Exactly. So it's very rewarding and refreshing to hear you say that you're along those lines.
Well, you know, this is the lesson we've all learned in the last 10 years with our financial data. If you might use a certain bank or a brokerage firm or a retirement account, you've got it at many different institutions. And I think most of us understand we've got to have access to that and then try to manage it ourselves on some kind of a software tool that helps us do that. So we've learned that lesson with financial data, even a very diverse, pluralistic society. We're probably going to have to learn to do the same thing with our health data.
Absolutely. Well, on behalf of Adobe, again, thank you for inviting us out to present, and we look forward to collaborating with you and your group and other players throughout the healthcare ecosystem in the future.
Likewise. Thanks a lot for coming.
Thanks again.